Hello everyone, welcome to Banu Pratibha lectures. Today we will be seeing about the osteology of scapula, but before going into the content, please don't forget to like, share and subscribe to our page and click on the bell icon for notification of our anatomy related videos. Now let us see into the scapula. So scapula is also known as the shoulder blade commonly, and it is a triangular shaped bone that is present in the posterolateral aspect of the thorax, and it is extending from the second rib to the seventh rib. So the easiest way to learn scapula is the 3-3-3 method, that is 3 borders, 3 angles and 3 processes. So before that, we will see what are the 2 surfaces of the scapula. So first we have the costal surface, which is related to the ribs anteriorly, and this is the anterior part, and it is also known as the subscapular fossa, and the muscle present here is subscapularis muscle. And then we have the dorsal part, the dorsal surface, which is divided into supraspinous fossa and infraspinous fossa by the spine of the scapula, also known as the spinous process. So in the supraspinous fossa we have the supraspinatus muscle, and in the infraspinous fossa we have the infraspinatus muscle. Now in the angles we have 3 angles. So first one is called the superior angle. This is the sharp projection at the ends of your scapula. And then we have the inferior angle, and then we have the lateral angle. So the lateral angle is formed by the glenoid cavity and the lateral border. So the 3 borders are superior border, then the medial border or the vertebral border, and axillary or the lateral border. Then we will see what are the 3 processes. The first process is called acromion process. The second one is called coracoid process, and the third one, as we already saw, is called the spine of scapula or the spinous process. So the main attachment of the coracoid process, let us see the main attachments of the coracoid process. It is 3 muscles and 3 ligaments. So the main 3 muscles are, you have the coracobrachialis, short head of biceps brachii, and pectoralis minor. And then the ligaments are coracoacromial ligament, coracoclavicular ligament and interclavicular ligament. Now let us see what are the other factors or other features present in the scapula. We have the suprascapular notch, which is going to act as a passage for the nerves, that is the suprascapular nerve, which is going to supply the supraspinatus muscle and the infraspinatus muscle. Then at the inferior angle in the costal surface, we have the attachment of the serratus anterior muscle, and then in the dorsal surface you have the levator scapulae muscle, then rhomboidus major and rhomboidus minor. Also, the inferior angle in the dorsal aspect gives attachment to the trapezius muscle. The spine of the scapula is going to give attachment and origin to 2 muscles. It originates the deltoid muscle, and it also gives attachment to trapezius muscle. Now let us see what is the clinical condition that can be caused by the scapula. So first thing is the winging of scapula that occurs when there is the removal of breast or any injury to the nerve. The nerve associated is the thoracic nerve, long thoracic nerve, or the nerve to serratus anterior of root value C5, C6 and C7. So when that happens, the inferior angle and the medial border is going to be protruded, unduly prominent, when the patient is going to hold their palms across the wall. That will show a winging of the scapula. And there is also Sprengel's deformity of the scapula, which is a congenital disorder. So hope you liked the video, and I think it is a perfect video for you to revise scapula, which is under 5 minutes. So please like, subscribe and follow us on Instagram also. Thank you.